I presented at ESTRO the early results from the RED LaIT-SABR study, which is a secondary analysis of the original LaIT-SABR study, a multi-center international study on patients affected by lung oligometastases from colorectal cancer. In the original LaIT-SABR study, the primary point was the local control, and we were also able to identify predictive factors of it. The secondary point was instead the time to the polymetastatic progression, which was defined as the occurrence of more than 5 new metastatic lesions. And we were able to identify some factors of polymetastatic progression, which were the number of metastases, stratified as 1, 2, 3, and 4, 5, and lesion diameter. However, we didn't evaluate the interplay between these two factors, and this is the goal of the RED LaIT-SABR study. So what we made is to combine these two factors, so the number of metastases with the cumulative GTV volume, and we were able to stratify patients and to determine different behavior of the disease in progressing to the polymetastatic disease. So patient with a small tumor load and with a few number of metastases and with a small tumor volume had a very long time to the polymetastatic progression. We identified several risk classes where the risk is the one of polymetastatic progression. For example, patients in the low risk group had 1 to 3 metastases and the cumulative GTV volume lower than 15.6 cubic centimeters. In the intermediate group, we had patients with 1 to 3 metastases with a cumulative tumor volume larger than 15.6 cubic centimeter. And in the high-risk population, we had patients with 4 or 5 metastases regardless of tumor volume. So the conclusion of the study is that the oligometastatic state is not an all or nothing phenomenon. It's a more complex disease. And as clinicians, we should pursue a personalized approach that takes into account several factors other than the sole number. So we were able to identify different potential population subgroups. Some of them seems to benefit more from local treatments, while others seems to rapidly progress to the polymetastatic disease, so amenable only of systemic treatment only. And this is in summary the results of the study.